So the first test we're going to do is the Patrick or Faber test, and for this one, my patient is going to be lying supine, and I'm going to place the foot of the involved side on the opposite knee, and then I'm going to stress the SI joint by extending the range of motion by putting a slight pressure on the knee and the hip. And so if she has any pain at the anterior hip during this, that could indicate a hip pathology. But if she has any pain around the buttocks area or the lumbar spine, that could indicate injury to the SI joint. And if she had any decreased range of motion compared to the opposite side, that could indicate that she has an iliopsoas muscle spasm or tight adductor muscles or even a labrum tear. So the next test we're going to do is the hip scoring test. And for this one, I'm going to fully flex. She's going to be lying supine, and I'm going to fully flex her hip and knee. And I'm going to apply a downwards pressure through the femoral shaft while repeatedly internally and externally rotating the hip. And I could do this at many different degrees of flexion. And if she had any pain or if this reproduced her symptoms, that could indicate a labrum tear, or it could indicate a deficit in the articular cartilage of the femur or the acetabula. And so the next test we're going to do is the anterior impingement test, also known as the Fader test. And for this one, my patient's supine again. And I'm going to place her hip at 90 degrees of flexion. And I'm going to internally rotate her hip and internally rotate and adduct at the same time. And if she had any pain, clicking, or popping with that, that could indicate an anterior superior labrum tear. But if she had any groin pain during that, that could indicate an anterior femoral acetabular impingement. So the next one we're going to do is the snapping hip maneuver test. And for this one, I'm going to have my patient supine, and I'm going to put her hip into flexion, and I'm going to externally rotate and abduct her hip, and then move her into extension and internal rotation. And if she had any snapping sensations, whether that was felt or heard, that could indicate that she has snapping hip syndrome. And this could also be done by having her stand and flexing her hip and externally rotating it as well. Last test we're going to do is the pubis symphysis gap test. And for this one, my patient's going to be supine, and I'm going to have her bring her hips and knees to 90. And I could hold her feet just to give her some more stabilization. And I'm going to place my fist in between her knees, and I'm going to have her adduct her legs. So then she's squeezing my fist in between her knees. And if she had any pain with this, that could indicate that she has osteitis pubis.